If you have, like we talked about, tummy tucks or say breast lifts, augmentations,
yes.
Some people do scar more than other people.
That's exactly.
And is it best to almost anticipate this so that, say, if you're contemplating having that kind of surgery, that you want to be ready with this as soon as the healing occurs?
That's very true, because most people, for the first several weeks, the scar will actually appear normal, but after about 6 weeks or so, you can start to see the demarcation between people who are not going to scar well versus people who are going to scar better. So that's the critical point where you can actually use the laser. But if they have a history of having a bad scar, you can basically start treating them within about 2 weeks after the surgery. So for my patients, especially if I know they've had a scar in the past, or they have other C-section scars that are bad, that I know this new scar may not be the best, we treat them very soon after the surgery.
All right, we've got to take a quick break. For more information about these laser treatments, you can give Dr. Rajagopal a call at 415-392-3333. Yeah, all right, that's enough. Or you can visit our website at sfcosmeticsurgery.com.
I recently had a tummy tuck done, and it left the ugliest scar on my stomach, and I was wondering if the lasers would help with that.
Good question.
Yes, it's an excellent question. Unfortunately, one of the side effects of a tummy tuck is a long scar, and then in some people the scar just doesn't heal well. It may not even be the actual surgery technique or the surgeon, it may just be the way the body heals. And so the V-beam laser is actually very good for any surgical scars, especially when the scar is relatively new. Is your scar new?
Monique, are you still with us?
4 months now.
Yeah,
about 4 months. Okay, so it's a relatively new scar. So it's probably, is it a little red and bumpy, raised?
It's more like a dark black. And it's raised, yes.
Raised. See, the laser will affect more the red part of the scar. So very early on, you may still have some redness to it. So when you have the redness, it'll help flatten the scar and remove the redness. If it's already turned very dark, then the laser won't help very much.
Is there such a thing as keloid scarring, right? Does this help with that? That's the very thick.
Yeah, a lot of times a keloid, before it becomes dark, it first is red. And what the redness denotes is that your body is laying down collagen in excess. It doesn't know when to stop. So it keeps laying it down without modulating the collagen. So when it initially turns red and bumpy, and then later turns darker. So if you can catch it at that red phase, you can actually remodel the scar and make it softer and flatter and less red.
Nature is really funny that way, because we're always trying to get more collagen into our faces in other ways, but you know,
not in the scar.
Not in the scar. All right, hopefully that answered your question, Monique.